A number of years ago, I was trying to figure out better ways to build the immune system. So I flew out west to a hospital that specialized in treating cancer patients. And as I went and I was speaking with the hospital administrator, we were talking about the major items they use to fight cancer. And what they would do is they would take the patient and they would give them a drug. They would have to move them from the floor to ICU for this process because it was so dangerous, he said. So they put him on ICU and they would give this drug, and the goal was to move the patient's temperature around 102 to 104. Now the challenge is exactly how much drug to give. And so they were constantly having to check that temperature and find out where that sweet spot was between the 102 and 103, because they had found that if you can get the temperature, the oral temperature between 102 and 103.9, that it significantly increased the white cell count. What the problem is let's say that they had given them the medication and they went well over the 103 into the 104, 105. Then they had to give another drug to pull that back down. And they were kind of giving drugs back and forth, trying to keep it within that sweet spot of 102 and 103.9. Well, there's a better way of doing that. And it's called hydrotherapy, and it's not a new treatment. It's been done for many, many years. And as I watched what they were doing, I asked the administrator, I said, why aren't you doing a hydrotherapy fever treatment? Because it's doing the exact same thing. Well, you just can't bill as much for doing a hydrotherapy treatment as you can putting a patient in the ICU and giving them drugs. So let's look at the simple way that you can do in your house, not alone, but with someone helping you. A fever treatment is significant. We would give our patients fever treatments, and I had learned from Loma Linda, from Dr. Charles Thomas, that it would raise the white cell count 7-fold, and I'm thinking, no way. So I had my nurses draw the labs at the beginning of the treatment, at the end of the treatment, after we poured the ice down their back, and then for every 30 minutes for the next 6 hours. Numerous patients. And we actually found that we had that baseline. At the end of the fever treatment, actually the white count goes down. But then as we poured that ice water down their back, boom, it was back up in less than 15 seconds. We were redrawing that lab, and that quickly it shot their white count up above where they were when they started. And then it kept climbing. Every 30 minutes, we kept checking it, kept climbing, and it finally peaked at 5 hours at 7-fold. Now, I stopped at 6 hours because our funding, I couldn't go longer than that, but a good friend of mine, Dr. Harold Cherney, out in Colorado, he did some testing on the fever treatments where he just took the labs every day, checking that white count. Dr. Cherney found it didn't come back to normal until 3 days. Now, I don't know how that bell curve went in that 3-day time frame, but I do know that at 5 hours, we peaked at 7-fold, or the white count 7 times higher than when we started. And Cherney's research found that it took 3 days for it to come back to normal. Well, what we do for our patients is we would do the treatment for 6 days a week. We'd let them off on Sabbath, and Sunday through Friday we were doing the fever treatments. So what do you need? You need a bathtub first. The person has to have the ability to get down in the bathtub and get back up safely. So you have the person hydrate beforehand, and then make sure they go to the bathroom, and then you'll draw water about 105, 106 degrees. And you can use a thermometer like this to test and see what that water temperature is. And you want that water between 105 and 106. You put the person in the water, and I'll put a washcloth in ice water. And then we'll put this washcloth on the person's head. You let them. You get a glass of water, maybe a straw, and let them sup on this once in a while. And if it's a short bathtub like at home, I'll have the water at their neckline, and then their legs up, and then I'll put a towel and keep pouring hot water over that towel to keep the legs nice and warm. I'd rather instead of the chest being out, have the legs out, and we'll do it that way. During this process, every 5 minutes, you're checking their temperature. And I don't have an oral thermometer with me, but use an oral thermometer. You're checking that oral temperature. You can also check their pulse every 5 minutes. And if they have a history of blood pressure, you can check their blood pressure also every 5 minutes. If their blood pressure starts going up too high, just stop the treatment at that point. If the temperature goes up, and which temperature does go up in a fever, you can because it's not actually a real fever, you can just pour a little ice, turn the spigot on for the cold water, and cool the water a little bit, and that temperature will drop back down. If you needed to come back, if the water starts getting a little cool and their temperature starts dropping, just put a little more hot water and it'll bring the temperature up. It's kind of like a double boiler. They actually don't have a fever. It's just making the body nice and warm. So what happens? You have the patient there. You're checking their temperature every, you can take a baseline temperature, baseline blood pressure, baseline pulse, and every 5 minutes you're checking that. If they get real tachycardia, and their pulse gets really on up there, you can just take a bag of ice and put it on the chest, and that pulse will come right back down. Think about when you go out running. It's not uncommon when you're out running, your pulse will get up to 130, 140. So it being 130 or 35 is not a big problem here in the bathtub. But if you're concerned, put a little ice on the chest and that tachycardia will come right back down. Tachycardia is when the pulse is over 100. Another thing we learned over time is have the person take some deep breaths every, say, 3 to 5 minutes. What happens is as they're in this fever treatment, they're under pressure, and they're not breathing as much. It's the pressure of the warm water, they're not breathing as much, and so their oxygen saturation may drop down around 93, 92, and so all you do is every few minutes just say, Henry, take you a couple breaths. Don't hyperventilate, but just take you a couple breaths. And that works well to keep that O2 sat right on up there where it belongs, the oxygen saturation. If the person can tolerate it, you want to go 30 minutes. So here's what you do. You keep checking that oral temp every couple minutes at first. Once it hits 102, 102.0, start your stopwatch. And you want them to be in the tub for 30 minutes at an oral temp between 102 and 103.9. But several things can happen. It can be a person that doesn't have a good constitution. And 5 minutes, 10 minutes in, and they just say, I can't handle this anymore. Not a problem. Don't say, well, Walt said you got to be in there 30 minutes, you're going to stay there. No. Say, oh, great, you did a good job. Go ahead and stop the treatment. Let's say if a person has a lot of stress, a lot of anxiety, a lot of nerve issues, some people just can't tolerate that treatment unless they take something ahead of time like B-complex or some vetiver essential oil or some lavender essential oil. I find B-complex is excellent, maybe 30 minutes before, calms their nerves, and then they're able to tolerate that full treatment. At the end of the treatment, when the 30 minutes is up, again, every 5 minutes also, you're putting the washcloth that you had on their head, you're putting in the water and the ice water and then putting it back on their head. You want to keep the brain good and cool. So at the end of the treatment, what I'll do is you lean the person forward, take the washcloth out, you lean the person forward because see, they've had ice cold on the head and they've had hot down here, and so you got vasodilation here, you got vasoconstriction here. When they get up, they can be a little woozy. I also like putting a gait belt around them or a towel around, a sheet around them, just to make sure, especially if it's an older person, making sure that you can walk that person without them having any gait issues. But I found when we started pouring this down their back, when we were finished, we really didn't have that problem anymore. So what you do is when you're finished with the 30 minutes, lean them forward, and then you pour your ice water down the back of their neck. And then let them recover from that. And then start letting the water out, have them stand up, and then you can shower them off with cooler water if you want to. Another key that Dr. Thomas said is you want to have them to lay down and sleep for 2 hours. Well, if that's the case, then you got to figure out how to get these wet clothes off of them and then go to bed and not get the bed wet. So it's good to use something that they can take off real easy. It's also good to have a man do man or a woman do woman if it's not spouses. And you can use just like a hospital gown or something, drop that off and dry off, put something else on, another gown or something, and then take the person to the bed to make sure they don't fall, and then put them in bed for 2 hours. When they're finished with the 2 hours, they can come on out and then take another shower because they're going to sweat and they can wash off that sweat. It's a real simple treatment, very, very effective, whether you're fighting cancer or whether you're just trying to get that immune system up to fight that flu or that cold, an excellent way to build the immune system.